nagose ku nkiko z'u Rwanda maze ndeba u Rwanda rwa Gasabo we yewega murebe mwe
inzira nziza
iyo mvuga inkuru nziza nabwiwe mba mvuga inzira nziza nagenze umva inzira nziza
Rwanda rwatubyaye bavuga urw'imisozi umva inzira nziza
iyo mvuga inkuru nziza nabwiwe mba mvuga inzira nziza nagenze umva inzira nziza akakwambara utabanya n'icyogera bihura amakareza byuma bitanu ameza neza basangiranye ndiwe ntari ubukunyi bw'u Rwanda intore z'inganzo ngari batari umutwe n'ibegamire se mudugu nuhi akabakunda akabimanzi y'imigo ko yanze gusigana umunsi witaba ameza neza cyogera mu nkuba y'uru ntaru yego tambuka neza byuma bitanu uratambuka neza ruzerekana bakuzi nk'amasobetse nabiranguranya amatovu iwacu niwe n'intaro urangirwa udakanganira bara ngo ntabwo nikoza mu Rwanda uyu uzazurebe u Rwanda rw'abanyarwanda no kure kwemana we uzazurebe u Rwanda rw'abanyarwanda no kure kwemana we uragenda
devastating diseases, preventable and treatable conditions that harm the lives and livelihoods of billions of people and impact the world's poorest and most vulnerable. Powerful partnerships are united in the global fight. We've already made incredible progress, proving that ending malaria and NTDs are achievable goals. But there is so much more to be done. This is the time. This is the year. This is the moment to renew our commitments and accelerate action against malaria and neglected tropical diseases. Because together, we can unlock the potential for countries to build a healthier, safer, and stronger world. This summit, hosted by the government of Rwanda, brings together some of the planet's leading change makers alongside the Commonwealth heads of government meeting. Together, we will celebrate country leadership, galvanize political commitment, drive innovation, and mobilize investment. By endorsing the Kigali Declaration on Neglected Tropical Diseases and driving pledges for the Global Fund's replenishment later this year, we will save millions more lives, end suffering caused by these diseases, stimulate economies, and ensure the world is ready to detect and respond to future health threats. So, welcome to the Kigali Summit. Welcome to a brighter future. Together, let's unlock the potential to end malaria and neglected tropical diseases for all.
And now, distinguished guests, please welcome on stage your MC for this session, your personality, Makeda Adio.
Check, a mic check. Oh. Can everyone hear me well? No? Let's go over here. We're gonna make it work. Okay, let's start from the top. Good morning.
And once again, I will do your intro, so it's a proper walk onto stage. Distinguished guests, media personality, your MC for the day, Makeda Mahadio.
Thank you. Your Excellencies, of course, honorable ministers, distinguished guests, and members of the media, good morning once again. Whether you are joining us from here at the Inare Conference Arena, or if you're joining us from online from around the world, we are so excited to welcome you to this historic Kigali Summit on malaria and neglected tropical diseases. My name is Makeda Mahadio, and it is my absolute honor and my pleasure to be guiding you through today's program live from Kigali, Rwanda. What incredible opening we had. That was our beautiful local traditional Rwandan dance troupe Inganzo Ngari. If you enjoyed their performance, you can go ahead and show them some appreciation. That really is that's the perfect way to open a summit like this. It's our hope that the Kigali Summit provides a landmark opportunity to renew much-needed commitments and investment in malaria and NTDs throughout the day. We invite you to immerse yourselves in some of our high-level speeches, commitments, engaging content, and discussions, all of which highlight how immediate action is necessary to end malaria and NTDs. Integration, innovation, new tools, financing, and regional coordination will guide us whilst being crucial enablers of fighting COVID-19 to prepare for future pandemics and strengthen health systems. Solid malaria and NTD programs will serve to unlock the potential of countries to build a safer world for everyone, everywhere. At this time, it gives me enormous pleasure to welcome the Minister of Health for Rwanda, the Honorable Dr. Daniel Ngabije, to make this morning's opening remarks.
Honorable Ministers, Honorable Regional Director of WHO Afro, Dr. Moeti, eminent guests, esteemed delegates, good morning. It is my pleasure to welcome you to the Kigali Summit on Malaria and Neglected Tropical Diseases. I would like to thank everyone for joining us during this moment. Taking place alongside the Commonwealth Heads of Government meeting, Kigali Summit on Malaria and NDs will reaffirm commitment to end malaria and neglected tropical diseases which still dramatically affect the lives of billions. Today's events will be one of a global nature, with speakers from across the world united in a common mission to ease the burden of these diseases. The Kigali Summit was first proposed in 2019, before the COVID-19 pandemic hit deeply and affected our societies. We now understand better that our collective health security is woven together. Malaria and NTDs respect no borders, and the renewed interest in these matters is greatly welcomed, both in the pursuit of their elimination and recognition that their burden on health system affects our ability to identify, track, and treat new diseases outbreaks. At the same time, we face many challenges. The disruption caused by COVID-19 to diseases control and elimination has been significant. I know that my country and so many other countries represented here worked with partners and put in significant effort to ensure we continue to avail adequate prevention and diagnostic tools, and also avail required treatment for malaria and NTDs. Yet, even with these efforts, malaria mortality grew globally last year for the first time in nearly a decade, and progress on NTDs is strengthening to unravel. We stand today at crossroads. We are almost midway to the Sustainable Development Goals and progress towards the goal of SDG 3, health and well-being for all, can only be realized if the change comes now and from all of us. Rwanda has adopted comprehensive integrated strategies that combine different types of interventions to reduce malaria and NTDs burden. It is more and more evident to all that to achieve malaria and NTDs control and elimination, it is imperative to work on the following strategies. 1, sustain investment in medical innovation, new technologies such as vaccines, drugs, and the next generation of insecticides. 2nd, to scale up cross-sectoral collaboration, community, and private sector engagement. 3rd, to adopt novel service delivery approaches to increase access to universal health care. Today's program will be focused on following themes: integration, innovation, regional coordination, and resource mobilization, which cut across both disease groups. In delivering against these themes, we unlock the potential of our efforts to scale up and defeat malaria and NTDs. We are excited to see the significant effort made by all parties who have committed in advance. I welcome and encourage and call for the highest level of ambition by those who will be announcing commitment for their first time today. Before we begin, I wish to take a moment to thank all those partners who have supported this event today. The leadership we seek to delivery is one that can only be achieved through partnership. With those words, it is my great pleasure to officially open proceedings of the 2022 Kigali Summit on Malaria and Neglected Tropical Disease. I thank you.
Thank you, Honorable Minister, for your words and commitment to the fight. Now, although we began our proceedings with a warm and energetic Rwandan welcome, our next opening performance speaks to the heart of this summit, and more specifically why we're here, what we hope to achieve, and what the end result could be for millions affected by these dreadful diseases. Distinguished guests, please welcome actress, dancer, choreographer, and recipient of 2018 MTV Video Music Award, Rwandan-born Sherry Silver.
Yes. Woo. Good. Good job. Yes. Woo. Like that. Woo. That is good. Oh.
It's not working.
Sherry, it's on. It's on.
We shall continue after school. Yes.
Diamba, hurry up, it's time for school.
Yeah. Bye. Bye. Yes.
Later that day, my cousin Gayemba came home feeling very weak. He could barely speak. It was only adequate healthcare that was needed. But unfortunately for him, he didn't get to play again. But together, today, we can make that change.
Okay. Oh, it's right after Sherry. Okay. And then, yes? Hey.
I'm going to mute your microphone from now on so that you don't get a lectern, but I think that's feeding through onto the live stream. I thought we did our intro fabulously, and I think you recovered extremely well. And I was like, I'm so not going to have you have that kind of intro. I was like, no, let's do this again.
So should I just take this off?
Not yet.
Welcome to the Kigali Summit on Malaria and NTDs 2022.
Thank you for being here at this vital moment.
And fighting against these deadly and life-limiting diseases, your strong leadership and commitment will save millions of lives. The security of the world's health is in your hands.
Let us make history and show the world that no human is limited.
And let's hear it one more time for Sherry Silver. Thank you, Sherry Silver, for that powerful depiction of the importance of why we're all here today. Our next speaker is a woman described by the Times Literary Supplement as the most prominent of a procession of critically acclaimed young Anglophone authors succeeding in attracting a new generation of readers to African literature. And I know she certainly did that for me. Distinguished guests, please welcome celebrated award-winning author who very recently received her 16th honorary doctorate degree, the incomparable Chimamanda Ngozi Adichie.
Good morning. It's so lovely to be here with so many brilliant people. I want to tell you a few personal malaria stories. So I was about 10 years old. My mother had brought me to the medical center on the campus of the University of Nigeria in Nsukka, where I grew up. As we sat waiting for the doctor, people stopped to say hello to my mother. The campus was a small community, and everyone knew everyone else. Each person who greeted my mother would then turn to me and say, "Ndo, sorry for your malaria." Malaria was so common that everyone assumed that if you were in hospital, it was because you had malaria. Actually, on that day, I was in hospital for an eye allergy. But it later occurred to me that it was the only time I had ever been to see a doctor for an illness that was not malaria. We knew malaria intimately. My malaria always came with a terrible rumbling ache that I can only describe as an anguish in my stomach. It left me lightheaded, weak, nauseous, helpless. My brother Okay's malaria came with very painful aches at his joints. For my brother Kene, it was a bitter taste on his tongue, and his head would feel swollen to almost twice its size. Each time I had malaria, I didn't go to school. Once in class 2, at the age of 13, I had a very bad case of malaria that made me miss a whole week of school. It was during that week that quadratic equations were covered in mathematics. I missed it all. And since then, I have never been able to make any sense of quadratic equations. So maybe the only good thing I can say for malaria is that I cannot be held responsible for how terrible I am at mathematics. It is all malaria's fault. But I have another darker story. My friend, who I will call E, was 2 years older than me. She was pretty and popular, and she had a skill that we children considered very exotic. She could crochet. She would hold a crochet needle and a ball of wool, and before you knew it, a hat or a shawl had materialized. One day she fell sick. It was, of course, malaria. She took chloroquine tablets. 2 days later, she was shaking in bed. Then she had seizures. Her skin was hot, and she was delirious. She was talking nonstop, but nothing she said made any sense. She was taken to the teaching hospital, which meant it was serious. She missed school for weeks. When finally she returned to school, we could tell that something was desperately wrong. Her eyes were glazed, and it seemed as if a different person had inhabited her body. We were told that she had cerebral malaria, that the malaria had got to her brain. It changed her life forever. But strangely, what haunted me the most was when it turned out that after that illness, she could no longer crochet. An illness can rob you of your talent, your special skill, your magic. She was never the same again. And I found myself thinking, just one mosquito bite and a person's life is changed forever. There are many stories like my friend's, and there are stories worse than hers. She did not die, but it is a kind of death to lose your life's potential forever. It is a kind of death to go from a bright person to a shadow of yourself. How can 25% of deaths in Nigeria be from malaria? I have to say that, like most Nigerians, I find myself being very protective of my country. And so when I read the statistics, the first thing I thought was, where did they get that from? But we know anecdotally, even anecdotally, that this is true. Why is it that so many people all over the world are still dying of malaria and other neglected tropical diseases that can be cured? It does not have to be like this. We can eradicate malaria and other neglected tropical diseases. And when we say neglected tropical diseases, I cannot help but wonder, neglected by whom? Neglected by us. Because we don't often hear of them, we tend to forget that there's so many diseases that are killing people and blighting people's lives that do not have to. And so today is about putting an end to that. Today is about this gathering of so many brilliant people where we can learn from one another and where we can finally say enough. Thank you.
Thank you for your powerful words and insights, Chimamanda. I know so many of us can relate to a lot of the stories that she told. Now, there certainly has been incredible progress made over the past 2 decades in the fight to end malaria and NTDs. It demonstrates that this is indeed an achievable goal, but despite all of these successes, malaria and NTDs persist in areas of poverty, affecting the lives of billions of people. We simply cannot allow half of the world to continue to suffer from preventable and treatable diseases. Together, we can drive much needed change to end this inequality and end malaria and NTDs. Dr. Ren Mingui has served as the WHO's Assistant Director General for HIV and AIDS, tuberculosis, malaria, and neglected tropical diseases since January 2016, and is continuing this work under this new title, Assistant Director General for Communicable Diseases. Prior to this role, he was Director General for International Cooperation in the National Health and Family Planning Commission of the People's Republic of China. He brings nearly 30 years of public health experience working on health policy and health reform in China's Ministry of Health, where he focused primarily on health systems research and health insurance reform. Ladies and gentlemen, Dr. Ren Mingui.
Thank you very much. Your Excellencies, Honorable Ministers, dear colleagues and friends, ladies and gentlemen, good morning. I'm honored to join you at this historic summit, which celebrates progress towards reductions and eliminations of malaria and neglected tropical disease, and give us opportunity to renew our commitment and unlock the potential towards our 2030 goals. There are many milestones to celebrate. In the last 2 decades, we have saved over 10 million lives from malaria and averted 1.7 billion malaria cases. We have also reduced the number of people requiring interventions for NTDs by 600 million and enabled 46 countries to be formally recognized by WHO as having eliminated at least one NTD so far. But we are off the track. We are off the track to achieve the 2030 malaria target for Commonwealth countries and the 2030 global malaria targets. Public health targets set out in the NTD roadmap 2021 to 2030s are also at risk. The COVID-19 pandemic has taken us further off track and increased inequalities and barriers to access. In order to get us back on track, we will need to push forward in 4 key areas. First, integration. We need to ensure the malaria and NTD interventions are well integrated into primary health care and the universal health coverage agendas. Indeed, investments in malaria and NTD services can lead to strong and resilient health systems and can be mobilized in pandemics, as we have seen during COVID-19. Second, innovation. We need to promote development of new tools, as well as the more innovative means to deliver them. Innovation is also needed to keep us ahead of the emerging biological threat, such as drug and infectious resistance, and to address technical gaps that still limit our response to certain NTDs. Third, investment. We must improve our investment in essential services for malaria and NTDs. Nearly 2 billion people are still in need of NTD interventions, and half of the world population continues to lack access to quality care, services, and life-saving malaria interventions. Despite economic contractions, we need to increase domestic investment in health while engage new partners and donors, mobilize more international resources and fundings, and successfully replenish the global funds to fight AIDS, TB, and malaria. Fourth, adaptation. We need to ensure the strong adaptation to global and regional and country contexts. Africa and Asia, in particular, carry the highest burdens of malaria and NTDs globally, and require strong response with commitment, coordination, and collaboration between countries. These actions will accelerate us towards the elimination of malaria and NTDs. Together, we can unlock potential. Thank you very much for your attention.
much, Dr. Mingui. Our next speaker has made the fight against neglected tropical diseases her life's work. Ladies and gentlemen, it gives me great pleasure to introduce Thoko Elfik Puli, the Executive Director of Uniting to Combat NTDs.
Can you hear me? Your Excellencies, honorable ministers, distinguished delegates, and friends, it is my great honor as Executive Director of Uniting to Combat NTDs to stand here in front of you to welcome you to the Kigali Summit on Malaria and NTDs. Our special and most heartfelt thanks to the government of Rwanda for walking the talk and making this summit a reality, and to our co-hosting partner, representing the malaria community, RBM Partnership to End NTDs, I had to sneak it there, hadn't I? The RBM Partnership to End Malaria. It's been over 3 years in the making, and it's here. The timing of the summit is crucial. We have less than 8 years to reach target 3.3 of the Sustainable Development Goals and the World Health Organization roadmap on NTD target of reducing by 90% the numbers of people requiring an intervention against an NTD. With 1.7 billion people still at risk of neglected tropical diseases, we have a lot of work to do, because this means we have to reduce this huge number to 200 million by 2030. This summit is vital. It will recognize the critical importance of investing in the fight against neglected tropical diseases and malaria. It will mobilize and profile vital commitments to fight against malaria and NTDs, including, as we'll see later, by heads of state and government-level leadership and investment. The Kigali Declaration on NTDs, which I'm absolutely proud of, is being launched today, is not just a piece of paper. It is a solemn commitment by leaders from around the world and from all walks of life to acknowledge that neglected tropical diseases are diseases of poverty and inequity, and that we all need to take collective action to end them. I'm proud that so many countries and leaders of key organizations and companies have already stepped up to endorse the Kigali Declaration in advance of its launch today, and we welcome others to do so. In fact, we urge them to do so. Likewise, I am proud of the incredible commitments that have already been made to address NTDs. We thank each and every one of you for doing so. We have an exceptional lineup of speakers for you today. This lineup will include head of states, ministers, leaders from pharmaceutical companies, communities, NGOs, philanthropists, and royalty. And most importantly, we will hear from people that are affected by these diseases that we are here to address today. We'll hear about the impact these diseases cause on their lives and why these diseases must be eliminated. Let us not forget that the true burden of malaria and NTDs falls on women and girls, and that our debt to them is highest. So, on behalf of Uniting to Combat NTDs, we thank our host country, the government of Rwanda, for warmly welcoming us to this city of 1,000 hills, Kigali. We thank each and every one of you here today for coming to this summit. We were so thrilled to see how many of you were already here this morning, all registered, accredited, and COVID negative. That's fantastic. Enjoy the summit, and we look forward to talking to you over lunchtime. Thank you.
Thank you so much, Ms. Elfik Puli. Of course, I can't speak on behalf of the government, but I can say that we are so excited to have everyone here with us in Kigali to celebrate this day. Our next speaker my next speaker has dedicated her career to fighting malaria. So please, everyone, help me in welcoming the interim CEO of RBM Partnership to End Malaria, Dr. Karine Karema.
Thank you, Makeda. Your Excellency, honorable ministers and esteemed delegates, with all protocol observed, it's my pleasure to address you today on behalf of the RBM Partnership to End Malaria and from my home country, Rwanda. I want to express my gratitude to His Excellency President Paul Kagame and the government of Rwanda for hosting the summit at a critical moment in the fight against malaria and neglected tropical diseases. I have just 3 minutes to introduce today's event. By the time I sit down, 3 children will be lost their life due to malaria. By the time we finish today, that number will be 480. Delegates, you have heard these numbers before, and yet it is important to remind ourselves this is what is at stake when we meet today. For myself and many others here today, malaria has a strong personal connection. As a young girl growing up in Africa, the disease claimed the lives of so many families, including my siblings, neighbors, communities. That was normal, it was accepted. And then we changed. We invested in malaria elimination program, pooled our resources, and through the Global Fund and other partners, collaborated across border, invested in efforts to put women and girls at the center, and invented new ways to fight malaria, the malaria parasite and the mosquito transmitted the disease. For the generation that comes after me, losing family members due to malaria is no longer a norm. Today's summit takes place at a critical juncture. As we recover from the impact of the COVID-19 disruption to malaria programs, we now have the highest malaria mortality rate for nearly a decade. Together, we need to commit to getting back on track. We need to ensure a successful replenishment of the Global Fund this autumn. We need to leverage the progress in innovation, integration, and resource mobilization, and we need to do it now. I thank all those who bolstered the malaria campaign with their commitment today and encourage all of us to play our part, because at the end, malaria starts with you and with me. Thank you.
Me tocó vivir lo de paludismo, me cogió cuando ya estaba en punto de dar la luz. Y tenía mucho miedo, para las mujeres embarazadas no hay tratamiento, me decían eso.
I found a big sore on my leg, very hard and very painful to my body. Friend of my uncle took me to hospital 30 kilometers away from where we were living, and the doctor started to care for my leg. Later, they told me that it was bloody ulcer.
بدت حكايتي مع المرض حوالي سنتين. كان عبارة عن ورم صغير في الأصبع، كان بيزداد فترة بعد فترة إلى أن بقى متضخم وظهرت جروح على الأصبع، بقت تطلع مادة سوداء.
yana kashe mana gabobin jiki, zazzaɓi jikinka ko hamma kai ma za ka ji zafi, tiri ko ina jikinka yake.
I started urinating blood. It was persistent. I would go to chemists and get drugs. They didn't know my background, that I came from a farming environment. So what they just had suspicion was a urinary tract infection. Until when I go to the teaching hospital, where a proper history was taken and discovered from the test that is schizophrenia.
Primeramente me atacó escalofrío y luego me ataca fiebre fuerte casi una semana. No podía levantarme, no podía ni comer, ni levantar, alzar la cabeza porque es feo, duele fuerte.
When I was affected with dengue, I would not be able to stand up in the morning. I would have high fevers at times. I would feel very tired. This affected my job and my inability to function properly at the workplace.
المرض في الرجل كل ما وقفت فترة طويلة شديد رجلي بتألمني وبيحصل ورم جزئي كده. كنت زمان بحب الكورة شديد، كنت بحب السفر، حاليا سبتها.
Kasek mun zo asibiti a bamu magani. In ba su da shi ma za su tura ka wani waje.
My little advice to you is to go to villages and town and educate my people about this body also.
The government also needs to invest in the prevention because what we need is access to clean water.
Que nos donan, diremos, el Ministerio del Toldo es bueno para nosotros, porque muchas veces la familia no tiene recursos económicos para comprar el toldo.
Many breakthroughs have been made with the COVID virus. What about these neglected diseases?
As hard as it was to watch parts of that video, it is important to reiterate that investments can fight these diseases and assist in building more resilient health systems. To expand on the progress made to date and the achievements which should be recognized, please welcome our next guest to introduce our first panel discussion of the day. He's an obstetrician and gynecologist who is also the Director General of the West African Health Organization. Please join me in welcoming Professor Stanley Okolo.
Thank you very much. Murakaza Neza. Welcome to Kigali. I have a distinguished panel of speakers and I'll take my seat very soon. We have the Honorable Dr. Osagie Ehanire, the Minister of Health of the Federal Republic of Nigeria, an orthopedic surgeon who trained in Germany and has been in the government of President Muhammadu Buhari since 2015, initially as the Minister of Health for State, or Minister of State for Health, but now the Honorable Minister of Health since 2019. Dr. Hanira, you're welcome. I have Her Excellency Joe Lomas, who might be well known to some of you in the audience because she was here as the UK, United Kingdom High Commissioner. He's not ambassador because it's all Commonwealth. High Commissioner to Rwanda until June last year, when she then got a new posting, as often happens with diplomats, and is now the UK Commonwealth Envoy, and she's back in London. Joe, you're welcome. I also have Russell Tamata, who is the Director General of the Ministry of Health of Vanuatu, and Russell has spent over 30 years working in different areas of the ministry. He has also worked with UNDP. Russell, you're welcome. And we also have Lucy Oyela. Lucy is a mother, she's a farmer, she's a community health worker, and she's from Uganda. Just next door, Lucy spent about 45 minutes flying over here. We have Russell, who spent about 22 hours coming from the Pacific. And then we have Joe, who spent about 10 hours traveling from London. And those of us from West Africa, who probably spent about another 20 hours because of all the connections. But you have people from the Pacific, from Asia, from Africa, from Europe, and you have people from policymakers to community health workers. Lucy, you're welcome. And whilst I take my seat, we're going to first of all see a video from Dr. Poonam Singh. Poonam is the WHO regional director, and you will have a video from her in the first few minutes, and then we will go on to the panelists who are here seated. Thank you very much.
Warm greetings, Your Excellency, President Paul Kagame, Excellencies, Heads of State and Government, Dr. Tedros, Director General WHO, Honorable Ministers of Health, Dr. Moeti, Regional Director for Africa, distinguished partners, participants. My sincere thanks to the government of Rwanda and our partners in uniting to combat NTDs and roll back malaria for inviting me to address this milestone event. Like you, the Southeast Asia region is 100% committed to ending neglected tropical diseases and has been since 2014, when it made eliminating NTDs and other diseases on the verge of elimination a flagship priority. Since then, we have seen incredible progress in our region, including the elimination of at least one NTD in more than 50% countries of the region. On malaria, the Southeast Asia region reached each of the time-bound milestones for morbidity and mortality of the WHO Global Technical Strategy. Amid the COVID-19 response, Maldives and Sri Lanka maintained their malaria-free status, and Bhutan, DPR Korea, Nepal, Thailand, and Timor-Leste from our region remain on track to achieve elimination by or before 2025. Two key factors contributed to the achievement of these milestones. First, political commitment at the highest level. Second, strong and sustained partnerships, including for research and innovation, which has facilitated the rapid translation of research findings into policy and practice. I commend member states on their tremendous achievements and also thank our many partners and friends who helped make this possible. Member states are both drivers and beneficiaries of progress towards the 2030 goals. Country ownership is essential to achieve them. At the same time, countries alone cannot achieve all. Rather, continued commitment of resources from countries and partners is essential, particularly in the last mile of disease elimination. No person or community can be left behind. I congratulate honorable dignitaries and participants on the launch of the Kigali Declaration, and I'm honored to be included in the 100 global leaders that will champion its delivery. Together, let us end the cycle of neglect for every community, everywhere. Thank you.
Thank you very much, Dr. Poonam Singh, Regional Director, WHO for Southeast Asia. And so we're here gathered to unlock the potential, and it is really a question of having a great panelist of members here to talk about where they see the next action in terms of eliminating malaria and NTD. And it's not really so much as emphasizing the problem, because we know the problem. But the question now is, what should we do next? And coming from West Africa, WAHO, we have 9 of our 15 countries that have eliminated at least one NTD, including Nigeria, of course. And really, we are now looking at how do we take it to the next level. We have had a declaration in terms of the ministers, in terms of eliminating malaria and NTDs, but there is a lot of work to do. So I then ask you, Joe, first, how can donor governments and the international community support countries in terms of progress against malaria and NTDs? And I'm sorry I'm putting you on the spot for all donor partners. Okay.
Thank you very much. And good morning, everybody. It's great to be back in Kigali. I spent all 3 years of my time in Kigali preparing for CHOGM, so I'm really pleased that I'm back here and it's really happening, and great to see such a wonderful crowd here. So So, Chair, in answer to your question, as we all know, COVID-19 disrupted so many systems and services globally, including health systems, and NTD services were among the most frequently disrupted of all essential health services, with treatment numbers falling to their lowest since 2011. And on malaria, COVID-19 led to an increase of 14 million cases and 69,000 deaths. However, despite these challenges, we have all rallied together in a remarkable way against malaria and NTDs. Countries affected have avoided the worst-case scenarios and continued to deliver services, often in very innovative ways. We've also seen some positive developments, including the WHO recommending the world's first malaria vaccine for children, the Gambia being declared trachoma-free in 2021, and Malawi being on track to eliminate it this year. So, how do we get back on track to meeting our commitments as Commonwealth to end the malaria epidemic by 2030 and to deliver the NTD roadmap? There are opportunities to learn from the COVID response to improve the effectiveness, integration and resilience of health systems. For example, countries built on existing networks of community healthcare workers and NTD delivery mechanisms to also deliver COVID-19 interventions. And you really saw that happening here in Rwanda, actually, when I was here. Donors also have a role to play in investing in research and development to come up with new diagnostics, therapeutics and prophylactics. And the UK continues to fund innovative research through our product development partnerships. This has previously included developing the world's first anti-malarial drug for children, which is estimated to have saved over 1 million lives. 1 million children, Chair, that's worth just reflecting on, right? This year also sees the 7th replenishment of the Global Fund. The fund provides over half of the international funding for malaria and is an essential partner for the UK in the fight against it, and also in strengthening health systems and supporting pandemic preparedness. So I think donors must also work in partnership with affected countries to support them building resilient health systems and must get behind country health plans. We also have a role to ensure that global supply chains for health commodities are sufficiently diverse and reliant to withstand future challenges. So global partnerships are as important as ever to combat these diseases. The UK is committed to working with other Commonwealth partners towards the target of halving malaria by 2023 and ending the epidemic by 2030. And in that spirit, we've signed up the Kigali Declaration, along with many others, towards delivering the WHO's NTD roadmap. And we very much urge others to do so, Chair. Marco De Ciane.
Thank you very much. Thank you very much. So you've heard it there. It's really aligning with country priorities and country plans. It's looking at commodities and supply chain, and it's also encouraging all partners, as UK has already declared and are going to sign the declaration, to also come on board and sign the declaration. My next question goes to the remaining 3 panelists.
Que nous sortons de cette pandémie, comment est-ce qu'on va pouvoir renforcer les programmes dans l'environnement actuel? Merci beaucoup, j'espère que vous m'entendez. Très bien, merci. La pandémie de la COVID-19 a eu des effets néfastes sur les systèmes à travers le pays. On a vu les mesures de restriction qui étaient nécessaires pour limiter
of supply chain, both globally and also nationally. And then there was also some fear among health workers who, in some cases, abandoned their duty posts, and patients who needed to go for healthcare and were afraid of being infected and also did not. So that disruption did affect delivery. But in Nigeria, we were able to weather that and provide routine services in spite of the threat of the pandemic. And we were able to deliver 23 million doses of SMC, seasonal malaria prevention, and in fact distribute in that period, 2021, 34 million long-lasting insecticide-related nets. As to the second question, what is going to be the benefit or rather the takeaway? Well, one of the things that emerged, and I think across the world, not only in Nigeria, was the emergence of virtual communication. A lot of meetings took place virtually, and that is translating into health delivery, virtual consultation, digital technology to increase connections between caregivers and users. And then, of course, the most important, the expansion of the primary healthcare network. We realize the importance of that level of healthcare. In Nigeria, we're trying to expand the primary healthcare to cover the whole country, one in every ward. That's it.
Thank you very much, and thank you so much for keeping to time. It's very, very difficult to deliver a response for a large country like Nigeria, but most other countries in just 2 minutes, because it's something that is being applied to nearly 200 million population of 214, I'm corrected. And so I come back to you, Russell Tamata, and from the Pacific and Vanuatu, your population, I think, is about 350,000. Same question to you, because, of course, you have the Polynesian Islands, and you guys sometimes work together. What has been the impact of COVID-19 on your ability to deliver malaria and NTD programs, and how do you see the build back in the current environment?
Thank you, Chair, for the opportunity to be part of this panel, and I'm honored to share our experience and respond to your question. Chair, Vanuatu has progressed swiftly over the years with the malaria and NTD programs. We have eliminated lymphatic filariasis, eliminated malaria in one province, and we have reduced dramatically hematite manifestations and now trachoma. Nevertheless, the impact of COVID-19 is real. It has disrupted a lot of our plans to deliver, and it has seized the supply chain to stop our activities. We are now seeing sporadic cases of malaria in 1 or 2 provinces, almost close to elimination. However, I think COVID-19 has also taught us to be resilient, has taught us new ways and ideas to maneuver during the pandemic in different ways and approaches. Indeed, we have done a very good job to control COVID, and I'm happy to say that at the moment we have only 14 deaths of COVID, and we'll be reopening our border comes 1st of July. What we have seen during the pandemic and what our lessons learned from the pandemic, which I think will contribute a lot with improving our NTD and malaria program, is how we have maneuvered to use some of the existing frameworks that we have in the government, which we have forgotten them. We leave them there. So one of the things that we come to realize is I think it's about time to look outside the box. We don't have to look and focus on health itself, the system. So at the moment, the government is trying to harmonizing all those other frameworks that we have discovered during the pandemic. And we believe with that we will be able to address the pandemic to give us a guarantee, should we have another pandemic. We will have a system that is robust, resilience, and we'll be able to sustain our program even if there's another pandemic. Thank you.
Thank you very much. Thanks. Thanks, Ross. Yes, you can hear me. Now, when we were listening to the introductory video, there was the man who had the Buruli ulcer, and he was asked, what would you say to the leaders? And he said, go to the villages, go to the towns, and look. And so we really come to somebody who is working at the, if you like, the coal face, at the front end of this, and that's over to you, Lucy. If I were to ask you the same question, what was it like for you delivering programs in terms of malaria and NTD in the district in Uganda during COVID? And how do you think you should probably look at now that we're coming out of COVID? How should it evolve?
Yeah, thank you very much. Good morning, everyone. As a community health workers, we carry out community mobilization, sensitization, and treatment. Community sensitization about COVID-19 and other diseases like malaria, NTD, TB, HIV, among others, during pandemic, help them to gain more knowledge and hope. Not only that, There was a lot of fear and confusion about COVID-19, since it has similar signs and symptoms like other common diseases in our community, like fever, sneezing, coughing, among others. In Uganda, with support from Global Fund, facility health workers train us on how to respond to COVID-19 responses and give us protective gears like face masks, gloves, sanitizers, which made it very easy for us to do the work. We also received treatment for malaria and ICCM program, ivermectin for ear blindness, praziquantel for cysto, vitamin A and deworming during Child Day Plus. Because of the trust they built in us, help us to deliver the message of COVID-19 and help us also to treat our people. The structure of NTD also help us to deliver the message of COVID-19. Since community meetings were stopped, door-to-door approaches were used during community sensitization, mass drug malaria testing and treatment, vaccinations, among others. In Uganda also during lockdown, we did not stop treatment. We continue treating our community up to date. While doing this work, we are also facing a lot of challenges, which include spending too much time doing the work, and yet it is voluntary. Community members still need more information from us about all the diseases. Some of the community health workers, they drop out of the work because of too much time required and no payment. The cost of living in our community has also gone high. Like in Uganda, a community health workers receive 3,000 Uganda shilling after distributing ivermectin and compiling the reports. So, for us to do our work well, these issues need to be addressed. Thank you.
Thank you very much. Thank you very much. And thank you for the work you do, and thank you for being there at the coalface. And in fact, thank you for answering the second question, which I was going to pose to the team. And you already telling us how you can deliver the benefits beyond what you've already done, and you thank the partners for I'll come back to you, Russell, and you only have 1 minute now, to now tell us what do you think would be how we can deliver benefits beyond malaria and NTDs in terms of using the approach that we have learned from COVID, and also the approach you also explained. You have only 1 minute for this.
Thank you, Chair. For us, this is all about establishing an effective and flexible system and building up strong networks, procedures and process proven to deliver results. I'm speaking from the experience we have from our programs. We fully understand that there are always competing priorities within our health programs. But if you would ask me about our secret, is we tend to focus on programs that have a lot of fundings. They've established themselves very well. And we use them as our guinea pigs. And then we develop the processes. And then we learn from them, and we develop other processes, other programs.
Focus on the programs and make the programs
effective.
Yes, so you use programs as entry point in terms of diversifying into
Exactly.
Thank you very much. And finally to you, Minister, you had already talked about ensuring that we don't let a crisis go to waste. We utilize it in terms of virtual meetings and other things. How do you see us you delivering benefits beyond malaria and NTD using the programs that you have? How do you see that? And I'm sorry, it's only a minute left.
Okay, I think one of the major benefits is the fact that attention to malaria and NTD draws attention to the importance of healthcare at grassroots level. This is medicine at grassroots, and it will galvanize the drive towards universal health coverage. Secondly, we know that the benefits of paying attention to NTD, malaria, helps the economy in that you have less absenteeism, you have more productivity, and that supports the economy. And finally, the importance of public health security. This is a very important aspect that it plays in integrating its role, also supports surveillance, reporting, and response for public health security.
Thank you so much, sir, and thank you to the audience. I know it's been very difficult in 9 minutes, 10 minutes to get from Asia to from Pacific, Europe, Asia, and of course from the minister from West Africa and from Uganda, which is next door. But I can say in one word, is solidarity, well, not one word, in a few words, solidarity, partnership, learn from COVID, utilize the things, and there is progress. We have heard that there is progress, but it's just to take it to the next level. For me, it's murakose to all of you. Thank you very much.
Professor Okolo, for that last panel discussion. It's discussion like these that are going to help to push the fight forward. We continue our program by inviting our next guest to the stage. Please welcome the Regional Director of the World Health Organization, Regional Office for Africa, Dr. Matshidiso Moeti.
Good morning, everyone. Honorable ministers who are here with us this morning, panel speakers and chairs, colleagues, experts, partners, community members, I'm very, very excited and honored to have been asked to give the opening keynote for this very important panel. And I'd like to start by thanking the organizers for having brought us here together for such an exciting and inspiring meeting. We've learned already a lot. We've been really entertained and inspired by the beautiful dancing that we've seen, and we are very determined, I'm certain, certainly I am, that by the time we come out of this wonderful day, we'll have better ideas, new ideas, and be able to work together to make things better. It's an honor to introduce a very important topic for our work collectively on malaria and neglected tropical diseases, and also for our work in WHO, on the benefits of integrating malaria and neglected tropical diseases, so the interventions, the resources, and how this will contribute to broader strengthening of health systems, which will then in turn be able to deliver services for all these diseases and for others, and bring us to a healthier and safer world. It's already been stated by other speakers, there has been progress on malaria and NTDs, on elimination and towards eradication. However, we see that the burden of these diseases remains high in the WHO Africa region, and in 2021, evaluations showed that progress has actually slowed down and or plateaued, and many countries were off track for the 2030 malaria and NTD milestones and targets. It's been said again that in addition, the COVID-19 pandemic slowed down progress even further, and its impact on economies in countries around the world is likely also going to have an impact on the financing that's available for programs to address these problems. We've seen in WHO looking at the delivery of health services using the Universal Health Coverage Index that there are gaps in the performance and delivery of our health services, both in terms of financing, which is limited still, and the capacity to deliver services to people. Verticalization in various ways of the financing, of the policy platforms and coordination interventions of the data systems and of delivery mechanisms is one of the challenges that we need to face with this integration initiative. We've seen also lessons learned that in responding to the COVID-19 pandemic, we had to expand the service delivery to the community level. I think the Nigerian minister said previously in the last panel how COVID impacted delivery services. So we have learned new ways of expanding the services, and I believe that they can help us. So how should we integrate? We can harmonize around delivery platforms for similar interventions. For example, when addressing the vectors for both NTDs and malaria, we can do this work together. We can deliver also, we know that the programs rely on treatment and delivery of chemotherapy. We can find ways to combine the delivery of treatment for malaria and preventive chemotherapy for neglected tropical diseases. As this gets done at the end of the day by the same healthcare workers, by the same community mobilizers and people, we can find ways to bring this together. The data systems, I believe, can really be integrated. And in WHO, we have a platform through ESPN where we have collected a lot of the data for NTDs. If we combine this and we connected this to malaria data, we can get more burn for the buck, as they say. If we find ways to bring all these services, the investments that we have together, and then we deliver to the same populations. And then finally, since I see that I'm running out of time, I'd like to say that we have an ambition in WHO to support this integrated functioning. One plea I'd like to make is that financing plays a big role in verticalization. If we fund programs and we'd like to see our people from the capital city to the district level, to the community level, and get our data reported separately, this does not help to integrate programs in countries. And I believe that it's an inefficient way of getting results. So if we can integrate the financing, if we can find ways for reporting to reflect all that we have achieved with the money given by different partners, we can get more value for the money that's invested. We can speed up our coverage and speed up the impact as well. So I look forward very much from hearing from our panel speakers what has been the experience in doing this, and I'd just like to promise that we in WHO will take this on board in the guidance we provide to countries. We agree with you that it's time to stop the verticalization, and I stop by saying that we are inspired by our late colleague Mwele Malechela and her vision for integrating this work. Let's do it in respect of Mwele. Thank you.
Joining us on stage now to introduce our next panel is the Executive Director for Africa for the Children's Investment Fund Foundation, that is CIFF. Distinguished guests, please welcome Faustina Fin Nyame.
Good morning, colleagues. It's so lovely to see so many of you here. So this panel is really around discussing integration of malaria and NTDs in programming across the health systems. Integration refers to a change in program approaches, ways to move from siloed approaches to more integrated, linking national health systems in a more holistic approach. It includes integration within and between NTD and malaria interventions, mainstreaming into national health systems, and working with other related sectors like water and sanitation. This session will demonstrate how well we managed integration and how we can drive efficiencies and in a limited resource setting and contribute to country ownership. The aim is to stimulate thinking on partnerships, attracting new partners that we don't normally work with, allies, and bring them into actually mainstreaming this work. This is a real opportunity for us to engage in integration. I would like to now introduce our panelists. So if we can please welcome Ms. Howard Solomon from the Director of Disease Prevention and Control, Directorate for the Federal Ministry of Health Ethiopia, Dr. Githenji, Group CEO of Amref Health Care Africa, Mr. Alan Van Molen, Senior Vice President, Global Corporate Affairs and Philanthropy at SC Johnson, and Ms. Chido Cleopatra Mumpa, Africa Youth Envoy. You're all very, very welcome. Can we have a round of applause for our distinguished guests? Okay. As you probably noticed, I'm not going to go through individuals' bios because we've got 20 minutes and I really want to spend the time getting people's thoughts around this very important subject area. So if I can start with the first question to first Dr. Hewitt and then also to Githenji as well, on talking about the successes. Can you please tell us or share your experiences of successful integrated programming across sectors and disease interventions or surveillance system? So over to you, Dr. Howard.
Good morning, everyone. Just to share our experience from Ethiopia, both the malaria and NTD program are integrated, fully integrated under the government health system. All the program packages are embedded under the health sector strategy plan and also with health delivery outlets. In addition, malaria and NTD program are leveraging from the national health system, all starting from the planning, implementation, monitoring and evaluation, as well as the data management, the logistic management, starting from the quantification up to the last mile delivery. They use the national health system in general. Also, it's very important, as you know, the primary health care is a core for public health function. So for effective and efficient and also for good access and quality of service, Ethiopian government been implementing the health extension program since 2003. This program is really very important and helps many health programs for better achievement. So in line with this, the government commitment is high and it can address with the involvement of the local government and sustainability issue. So currently we do have more than 14,000 health extension workers. They are providing service at the ground level and all they are under the government payroll. In addition, integration is very important across programs, also across sectors. So intra and inter integration has also good experience in my country. I can mention the integration between malaria and NTD. There is an outreach campaign. There was an outreach campaign with Matra, mainly for malaria and trachoma. There is also WASH NTD integration conducted in wide scale in the country. Also, different line ministries working in collaboration with the Ministry of Health, including the Ministry of Agriculture, Ministry of Education, and also other very important stakeholders, including key implementing partners. Thank you.
Thank you for those very important comments, especially around sustainability and the importance of that. So if I come to you, Alan, can you tell us what you have seen across this area?
Sure. First, I'd like to say our Chairman and Chief Executive Officer, Dr. Fisk Johnson, couldn't be with us because he contracted COVID. So I'm going to be stand-in. I'll try to do my best to cover for him. I think the greatest success we've seen in East Africa is here in Rwanda, partnering with the Rwandan government and the Society for Family Health in building health posts in rural Rwanda. And what we've done there is provide integrated health services there while helping to build a public health infrastructure that decreases the travel time, but from 3 days to get medical treatment in this country down to 3 hours in many instances. And these health posts not only educate on malaria, educate on nutrition, but they also provide diagnosis of malaria, malaria treatment, prenatal care, and now these health posts are expanding to include optical care and dental care. So I think that's by far our greatest example, again, partnering with government, partnering with civil society, and putting services nearest to the people who need them most.
So important. You managed to cut it down by 3 days. That is significant, and that is very, very important. So if we can go to our second question, which is all about the challenges. I think many of us have the intentions to integrate, but we're constantly coming across challenges and barriers that stops us from being able to do that. So again, I come to you, Howard, for you to tell us, in your experience, what are the challenges that you are facing, and how have you been able to overcome them?
Issue. In terms of challenge, of course, during the implementation of integration, there are so many confrontations, especially the resource issue and also the effective coordination capacity. So mainly regarding the resource, especially on the low or limited resource setup countries, it is one of the giant challenge. Maybe from my country experience, we try to alleviate this challenge by creating a kind of pool funding. So what we call SDG pool fund, and we do have currently about 11 contributors, and that are mainly from a multilateral and bilateral organization. So the mechanism of funding other program is by reviewing the priority of the gap. So by doing that, we can to solve our challenge in terms of resource shortage and also leveraging what we have. The other important thing is from the donor side. I can mention the Global Fund and Gavi. These donors have special interests for special programs. However, they give us also good opportunity, the general health system, to get leverage and also supported by the resource from those donors. So by having that opportunity, we can also strengthen the laboratory, the human capacity, as well as the information and the logistic management. So such kind of arrangement is very important. Instead of having a silo type of arrangement, we have to leverage and support other programs. So by doing that, definitely we can be on track and support the programs. Thank you.
Thank you for that. And Githinji, the same question to you. I know you are very passionate about this, and you spent a lot of time trying to really think through what are the bottlenecks for Kenya and across Africa, and what we can do.
Well, thank you. Thank you, Faustina. Jambo.
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 Yes, Kiswahili is now a national, continental language, so I thought I would just say hi to you in that language. And I think, I have not much to add to what has been said earlier by the Regional Director of WHO, Moeti, on the challenges of integration and what he would have said. But let's just reflect on why we are here. Number one is to understand that integration is the norm. Verticalization is the exception. If we agree that, then we are trying to work together. How do we move back to the norm? We shouldn't see verticalization as a norm. But how did we get there? We started off many years ago by having a health system that had growing inequity. In the 80s, we had integration. After the Almaty Declaration, primary health care, we had fairly good integration. But as the inequities went ahead, and by the year 2000, we had major challenges, we started to find man-made solutions to the health system failures, inequities. And when we created these vertical solutions to mend the challenges of the health system, we then created vertical financing to support it. I think that's what you were saying, and that's what we created vertical financing to resolve that challenge. And by creating vertical financing, we then created vertical reporting systems to account for the financing. And then after that, we created structures in organizations and in government to allow us to do vertical reporting for the vertical financing, for the vertical solutions. And then we continued further to now create incentives to enable this broken system. What this has done is resulted in less and less focus on the health system and more focus on the vertical solutions we create. But when we think about it, today in the morning I was talking to someone here from Rwanda and asked, which is the commonest female name in Rwanda? I was told this Uwase, and I'm sure there are many Uwases here from Rwanda now. So let me use Uwase. And I watched the video earlier that where a man said, I had a sore on my toe, and I went to the health center. They didn't say I had Buruli ulcer, therefore I went to the health center. They said they had a sore. And when you go to the health center, you find that across the continent, we have singularly resourced health centers. It's one nurse who is sorting out everything across the health system. So if we don't integrate, we're actually missing an opportunity. But you can see from previously, the challenge is we have created this whole system to support verticalization. We have to break the bank. That's the only thing we have to do to overcome these challenges. I'll stop there, then we'll come to more discussion later.
All right, great points, absolutely. And I really love that, integration is the norm. And we keep breaking the norm by all these other things that we are doing, and, vertical funding by donors, vertical programming, which really is the bottleneck and the challenges that we face. I wanted to quickly go back to you, Hillary, before I go to Chido. In Ethiopia, I know that, one health community health worker may be talking to communities about 18 different things at every visit. I mean, what are your reflections on that when it comes to integration?
As I said, the health extension program is a brand for Ethiopia, and we really get benefited from that kind of arrangement. Even if the health extension worker is one person which go to the village, but she carries so many programs agenda to the community, to the household, to the village. So it's very effective and also efficient. Not only that, also the program helps the community to deliver the lower level health service delivery that can also bring the community ownership and involvement. So it's a very good approach, and my advice is also to have such kind of arrangement to have effective and efficient PHCU at the ground level. Thank you.
What are your thoughts about integration and the challenges and bottlenecks?
Okay, thank you for that. I think first of all, I'm very excited for this opportunity, which is really showing that we've integrated a young person as a part of this panel. And, as the Special Envoy in Youth to the African Union chairperson, representing the 55 member states on all youth affairs, part of my role involves ensuring that we include and we integrate young people when it comes to socio-economic initiatives. So I'm going to tackle that question from that context. I think the challenge that we've been faced with as young people has to do with perception. We really need to change the mindset and shift when it comes to the perception for young people. I mean, often young people are not viewed or engaged as experts within their respective rights. We only have young people volunteering every now and again in different initiatives, but there's so much more that we can bring onto the table as experts as well as innovation. I've had the opportunity, to have that access to head of states and, to be part of the African Union chairperson's delegation to lobby for different initiatives. But you can imagine if we had more young people that have been put on that table, more could be done in terms of, collaborating and having a common goal. So now because of that perception, I believe that integration is weak at the moment, and there's really so much more that we can do. Secondly, when it comes to access to funding and finance for young people, we have young people that are experts and that are well-informed when it comes to, such issues to do with NTDs and malaria. But if we provide more access when it comes to funding for young people, to lobby, advocacy, as well as to bring innovations within the space of NTDs and malaria, then definitely more can be done with that integration. Yeah.
Thank you, and thank you for bringing that. Yes, I think she does deserve a round of applause, for bringing that. It's really important that we bring young people in every conversation and every part of our decision-making. It's a critical component. So if we go to our third question, which is really about thinking about what are the great opportunities to further integrate NTDs and malaria programs into the wider health sector and systems. So if again I come to you, Gudenji, and for you to express how you see this.
Well, I think the first opportunity is today. It's here. We're here in Kigali, and this is the first opportunity that we must take. Why do tomorrow what we can do today? By listening more to each other today at this summit and making declarations and commitments that we can follow up on. But it's not simple. As I said earlier, we created a system that needs to be broken. It's not easy to break into the bank. And we have to break the bank, actually, for us to make this work. The first thing is we need to think and redesign the health system. To start with the person I talked about, Uwase, and all the people we saw in this video here. So I want to start a movement of hashtag Uwase, really, so that we start to think about how Uwase is at the center of the health system. Remembering that it's actually not diseases that are neglected. It is people that are neglected, not diseases. So how do we actually make sure that the people are at the center of this system? So the first thing we need to do, and I'm glad that this meeting has quite a heavy presence of WHO, is rethink the WHO health system building blocks. We've always said that the WHO building blocks, which are supply side, need to have people as the seventh building block, beyond the six that have been designed. Because then when we add the seventh building block as people, then we centralize people into the health system, whether it's healthcare or prevention or promotion. That has already been considered. I see that in WHO discussions, that now we're going to use more of a primary healthcare, people-oriented, community-oriented health system for the future. And I think the COVID is what has brought this rethink of the health systems. To remodel the health system and redesign it, we need to think about the tenets and the three stones, of the fireplace of primary healthcare. Communities at the center, multi-sectoral action, which is all part of NTD response, and finally this issue of primary care that is holistic, promotive, preventive. If we don't create that system, then the desire to create vertical programs continues. So we have to reorient the health system. The next thing is to look at fit-for-purpose health workforce. This fit-for-purpose health workforce that is oriented to an entire integrated approach is important. But two last points is government leadership. Honorable Gamija is here. Many years ago when I was working in cleft care, I came to Rwanda and I was told, you're not going to tell us what to do, we are going to tell you what to do, and we are going to tell you how to do it. And I think we need to learn more from each other. And I think more South-South learning and sharing excellence where things have worked is going to be important, because it's not easy to reorient this structured system because of the reporting mechanisms, donors. Government leadership is really going to lead the reorienting of the health system to be more holistic and more integrated, so that we achieve hashtag Uwase at the center. I love it.
Yeah. Alan, I mean, in your view, what are the opportunities? How do we change these?
I think that we need to capture the impatience of youth, and you just heard that a minute ago. I think that the impatience of youth is going to push action, and it's going to push action from the public sector, it's going to push action from the private sector, and it's also going to not settle the status quo. And I think we can take lessons out of what we've just learned from COVID and how the public sector and private sector can come together with civil society and speed solutions to the people that need them most. I think the other thing is that all of us, all participants, whether we're funders or whether we're private sector like me, should really have zero patience with bureaucracy. There's a lot of bureaucracy that I think is slowing innovation, and slowing innovation that can get important interventions across all of these public health issues to the people who need those interventions the quickest.
Absolutely agree. Thank you for that. And since you have such a powerful voice and a powerful platform, Chido, what do you think we should be doing? What are the opportunities?
Okay, so my constituency makes up 70% of the population in Africa. And I think that already says a lot. We need to make sure that we intentionally and purposefully engage and integrate young people. And I believe that when we engage this population, it offers a great dividend and return in public health, and include reduced mortalities. Now imagine we have young people making these demands, ensuring that they go to their governments and make demands when it comes to NTDs and malaria. Then we have a greater impact. So we really need to be intentional about this, And just to zone in on a personal story of my own, how I got empowered and now I'm in this role. I was a volunteer in Zimbabwe, and that's how I got to learn about the NTDs and in terms of advocacy work around malaria. I started off with me being a volunteer in Zimbabwe with such initiatives, And I got to learn more about this through the Global Shapers community. And, one of my special advisors, who also happens to be in this room, Mr. Jero Chirinda, who put me into the Global Shapers community and started telling me more about NTDs and malaria, and also had a vision to see how we can move this from being a local initiative and now a global initiative that we see today. The likes of, Mrs. Tsitsi Masiwa, who enabled us and also, helped us to learn more about NTDs and learn more about how we can tackle this issue on malaria as part of the process of MDAs. If it wasn't for that I was given that access and, I was empowered. And now when you look at UTC, that are providing such platforms for young people, through the, United Combat for Youth when it comes to NTDs and malaria, I was empowered from there. And when I look at myself now, sitting here, being part of this panel, it's because of that we started back home, the access I was given to also be in this fight against NTDs and malaria. And now when I'm in this role, because I'm well informed and I'm aware of what is happening on the ground, I can then advocate at member state level, at policy level, and mobilize more young people within the 55 member states so that we can fight this as the largest population, build the Africa that we want.
Yeah. Excellent comments. We couldn't have said it better myself. And, we close with such a powerful statement. But just before we finish, I really would like to thank my panelists for such an interesting, passionate, motivating conversation. And also from, myself as the Executive Director for SIF, this is an area that we are absolutely committed to. We're working with Bill Melinda Gates Foundation, we're working with Elmer Foundation, where we're on a project called Arise, where we are testing this integrated thinking and modeling in actual practice. So, we want all of you to work with us to make sure that really happens and we can share the knowledge afterwards. Thank you for being such a wonderful audience, and thank you, my panelists.
Thank you to all of our moderators and panelists for a most informative first half to our proceedings. At this time, I would like to invite you to now stretch your legs and enjoy a 20-minute comfort break to allow us and you to prepare for the next series of discussions and content engagement. Now, if some of you do need some help with translations, please do not forget to go ahead and take a headphone. They are standing outside of the room ready to assist you. Our protocol will be there. Channel 2 is French, and of course, Channel 1 is English. So let's go ahead and synchronize our watches with the people in the room and the people who are online. 20 minutes, we will be back here. So we look forward to seeing you back in the room and back online at that time for another very special performance featuring local Rwanda artists and other vocalists from South Africa to Mexico, and from Bangladesh to Nigeria, and from Cameroon to Ghana. All right, so we'll see you soon. Enjoy your break.